What your feet and legs are secretly telling you about high blood sugar. What if your feet were trying to warn you about diabetes right now? Most people think diabetes begins with a blood test, a doctor's diagnosis, or a sudden health scare. But in reality, your body often starts sending warning signals long before that happens. The surprising part is that some of those warning signs may appear in your feet and legs. You might notice a tingling sensation in your toes. Your feet may feel unusually numb. Perhaps your skin has become extremely dry, or a small cut seems to take forever to heal. Many people dismiss these changes as signs of aging, stress, poor circulation, or simply spending too much time on their feet. But sometimes, these symptoms can be warning signs that your blood sugar is higher than it should be. According to the World Health Organization, millions of people around the world are living with diabetes, and many don't even realize they have it. High blood sugar can quietly damage blood vessels, nerves, and vital organs for years before a diagnosis is made. That's why learning to recognize the early warning signs is so important. In today's video, we'll explore some of the most common ways your feet and legs may reveal that your blood sugar is too high. We'll explain why these symptoms happen, what they could mean, and when it's time to talk to your healthcare provider. We'll also discuss practical lifestyle habits that may help support healthy blood sugar levels and overall metabolic health. Before we get started, if you're interested in natural wellness, healthy aging, nutrition, and evidence-based health information, make sure you subscribe to My Emerald Health and turn on notifications so you don't miss our future videos. Also, don't forget to check the links in the description below. We've included links to some of our recommended health products, educational resources, and wellness tools that may help support your health journey. Be sure to review them and choose products that are appropriate for your individual needs. Now let's look at the warning signs your feet and legs may be sending and why paying attention to them could make a major difference in your health. Sign number 1. Tingling or pins and needles sensations in your feet. One of the earliest and most commonly overlooked warning signs of high blood sugar is a tingling sensation in the feet. Some people describe it as pins and needles. Others say it feels like tiny electric shocks, a crawling sensation, or mild numbness that comes and goes. At first, these symptoms may seem harmless. You may only notice them at night or after sitting for a long period. Because the feeling isn't usually severe in the beginning, many people ignore it. However, this sensation can be one of the earliest signs of nerve damage caused by elevated blood sugar levels. Doctors refer to this condition as diabetic peripheral neuropathy. Over time, excess sugar in the bloodstream can damage the tiny blood vessels that nourish your nerves. When nerves don't receive enough oxygen and nutrients, they begin to function less effectively. The result is abnormal sensations that often start in the toes and gradually spread upward into the feet and legs. The Centers for Disease Control and Prevention notes that diabetic neuropathy commonly begins in the feet and lower legs because these nerves are among the longest in the body and are particularly vulnerable to damage. If you've been experiencing unexplained tingling sensations regularly, it may be worth discussing with your healthcare provider. Sign number 2. Burning feet, especially at night. Have you ever climbed into bed and noticed that your feet felt unusually hot or as though they were burning? Many individuals with poorly controlled blood sugar experience this symptom. Some describe it as walking on hot pavement. Others say it feels as though their feet are on fire, even when they feel cool to the touch. This can happen because damaged nerves sometimes send faulty pain signals to the brain. The sensation may become more noticeable during the evening when external distractions are reduced and your attention naturally shifts toward bodily sensations. For some people, the discomfort becomes severe enough to interfere with sleep, leading to fatigue and reduced quality of life. Persistent burning sensations should never be ignored, especially if they occur alongside tingling or numbness. Sign number 3. Numbness in the toes and feet. While pain can certainly be concerning, numbness may actually pose a greater danger. As nerve damage progresses, the nerves may lose their ability to transmit signals properly. When this happens, portions of the feet may begin losing sensation altogether. You might step on a sharp object without realizing it. You may develop a blister from a shoe and not notice it. You could sustain a small injury and remain completely unaware of it until infection develops. According to diabetes experts, loss of sensation is one of the primary reasons people with diabetes are encouraged to inspect their feet regularly. What begins as a minor injury can sometimes develop into a serious problem if left untreated. Sign number 4. Extremely dry skin on the feet and lower legs. Your skin often reflects what's happening inside your body. High blood sugar can contribute to dehydration, reducing the moisture available to your skin. As a result, many people notice dry feet, flaky skin, cracked heels, persistent itching, rough patches around the ankles and lower legs. Poor circulation may further worsen these symptoms by limiting the delivery of nutrients and oxygen to skin tissues. If you've noticed that your feet remain unusually dry despite using moisturizers, it could be worth paying closer attention to your overall health and blood sugar status. Sign number 5. Slow healing cuts, scratches, and blisters. One of the most important warning signs of diabetes is delayed healing. Under normal circumstances, your body repairs minor injuries fairly quickly. However, when blood sugar levels remain elevated for long periods, healing can slow dramatically. A small scratch may linger for weeks. A blister may take far longer than expected to heal. Minor cuts may repeatedly become infected. High blood sugar can impair circulation and weaken immune function, making it harder for the body to fight infection and repair damaged tissue. This is one reason healthcare professionals encourage people with diabetes to take even small foot injuries seriously. Sign number 6. Changes in the appearance of your skin. Certain skin changes may also serve as warning signs of insulin resistance and diabetes. Some people develop darker patches of skin, especially around the neck, underarms, or other skin folds. This condition is known as acanthosis nigricans. According to diabetes specialists, it is often associated with insulin resistance, a condition that frequently develops before type 2 diabetes. You may also notice shiny skin on the lower legs, discoloration, or other unusual changes that shouldn't be ignored. Your skin often provides valuable clues about your internal health. Sign number 7. Frequent leg cramps. Many people don't realize that recurring leg cramps can sometimes be linked to diabetes. Poor circulation, nerve damage, and dehydration associated with elevated blood sugar may increase the likelihood of cramping. These cramps often occur at night and may affect the calves, feet, or toes. While occasional cramps are common, frequent unexplained cramping deserves attention, particularly when accompanied by other symptoms discussed in this video. Final thoughts. Your feet and legs may reveal important clues about your health long before a blood test confirms a problem. Tingling, burning sensations, numbness, dry skin, slow healing wounds, frequent cramps. These symptoms don't automatically mean you have diabetes, but they are signs worth paying attention to. The good news is that early action can make a tremendous difference. Healthy eating habits, regular physical activity, maintaining a healthy weight, getting enough sleep, and working closely with your healthcare provider can all play an important role in supporting healthy blood sugar levels. The earlier you recognize potential warning signs, the better your chances of preventing serious complications. If you found this video helpful, please give it a thumbs up, share it with friends and family, and subscribe to My Emerald Health for more evidence-based health and wellness content. And once again, don't forget to check out the recommended products and resources linked in the description below. Disclaimer: the information provided in this video is for educational and informational purposes only, and is not intended as medical advice, diagnosis, or treatment. Always consult a qualified healthcare professional regarding any medical concerns, symptoms, or changes to your health. Never ignore professional medical advice or delay seeking treatment because of information you have seen in this video. Individual health needs vary, and results may differ from person to person.